Hello friends, it's pleasure to have you back on the channel of Clinical Care Insight. Today we are going to discuss about the one category of drug under the subject pharmacology, and that is called as the psychiatric drug, or also called as the psychotropic drug. Fine. These drugs basically help in the mental illness. So today's our topic of discussion is drug used in the mental illness. Fine. See, the psychopharmacology is very interesting branch of medical science. It's a very interesting branch of medical science, and also here we have to use the drugs, okay, in a very, you can say, precaution manner. We have to take the appropriate precautions, okay. We have to always, whenever we prescribe the drug to a patient and whenever these drugs are used, fine, these drugs are used with very, you can say, keen observation, fine, and also these drugs are indicated in the psychiatric illness, or you can say the mental illness. Got it? Now, this, you can say, the drugs which is basically acting on the mental illness, okay, which is used to manage the mental illness, they are, you can say, not available in over the counter, okay. These drugs are only available when it is prescribed, okay. When you show the prescriptions, these drugs you will get. Otherwise, these drugs are not available for the over the counter medicine. Got it? No problem. Now, so in this today's lecture, we will discuss the basics about what is actually the mental illness, fine, what are the types of mental illness, got it, and what are the drugs which we will use to manage the mental illness. So here is our today's lecture outline. First, we will discuss about the psychotropic drugs. Okay, what is the mean by the psychotropic drug? Then we will move ahead and we will discuss that when we use these drugs, when these drugs is actually prescribed, okay. Then we will discuss about the classification of these psychotropic drugs, okay. And we will also discuss about the antipsychotic drug, which is a one kind of psychotropic drug. Fine, no problem. Now, psychotropic drugs are basically a group of drugs, okay, which is used to cure the mental illness, okay, or also which is used, first of all, which is used to cure the mental illnesses, okay. Mental illnesses, different types of mental illnesses, which we will see in after a few minutes. Also, it is also used to manage the symptoms. Either this category of drugs either manage the symptoms, psychiatric symptoms, or either it cure, okay. Either it provide the symptomatological management for the psychiatric patient or mentally ill patient, or it's also manage the symptoms of mentally ill patients. Got it? No problem. Now, this comes under the, you can say, a specific branch of pharmacology, and that is called as the psychopharmacology, okay. What it is called as? It is called as the psychopharmacology. Got it? The another thing about this psychotropic drug is that these drugs are not a normal drug. These are not a normal drug. So if you're talking about the over the counter availability, then it is not available on the OTC counter. It is only available on the demand of prescription, okay. It is prescribed drug, okay. These drugs are the prescribed drugs. The another thing about this drug is that although these drugs manage the psychiatric symptoms like the hallucinations, delusion, illusion, disturbed thought, fine, and there are so many other psychiatric symptoms, but these drugs, they do have the side effects, okay, and these side effects are very, you can say, these side effects are very dangerous. Got it? So they are very good, okay, they are good to manage the psychiatric symptoms, the mental illness symptoms, okay, but they do have the side effects, and these side effects is cannot, you can say, encountered. These side effects are cannot encounter. Okay. a physicians or a psychiatrists, they give the, you can say, the vital attention toward the side effects. Fine, no problem. Now, coming to the another thing about these psychotropic drugs. These drugs, okay, they work where? Absolutely, these drugs work on the central nervous system. Got it? And these drugs are primarily to manage the psychosis. Okay, these drugs are primarily used to manage the psychosis. Now, what I mean by the psychosis? Okay, I use the different terms, like I use the psychosis, I use some of the mental symptoms like the hallucination, delusion, illusion, disturbed thought. So that these all terms I will describe. Okay, I will describe in a few minutes, but for a while you just understand that psychosis means patient is unattached, or you can say the detached with the reality. Okay, this is basically the loss of contact with reality. This is loss of contact with reality. Got it? No problem. There is a similar words, okay, which is the similar word, and that is called as the neurosis. Neurosis is different from the psychosis. Okay, neurosis is totally different from the psychosis. Here, what is happening here? Patient, okay, patient is unattached with the reality. Okay, they lose the contact, loss of contact with the reality. Whereas in the case of neurosis, there is contact with the reality. Okay, there is contact with reality, but patients show some of the, you can say, disturbed behavior. Okay, so under the neurosis, some of the diseases comes like the anxiety. Okay, anxiety is one of the disease which comes under the neurosis. Another disease, you take the example of the different types of phobias. Okay, of fear. Okay, phobias. So phobias, anxiety, this comes under the neurosis. In this disease, you can say the some degree of patient lose the contact with the reality, but they do aware about their present environment. But in the case of psychosis, patients lose the contact with the reality. And one of the, you can say, the classical example of the psychosis is the schizophrenia. Okay, schizophrenia. It's one classical example in which the psychosis are commonly seen. Got it? No problem. Now, these psychotropic drugs, they are highly potent drugs. They are highly potent drugs, and they are available in the form of tablet. Okay, they are also available for the emergency purpose. They are also available in the form of, you can say, the IV drugs, intravenous drugs. The parental routes are there, okay, and as well as the oral routes are there. Fine. If we're talking about the pharmacokinetics of these drugs, then these drugs mainly, you can say, absorb. There is very less absorption in the oral cavity. Got it? And these drugs, they primarily goes to the liver, and they are lipid soluble drugs, because these drugs have to go to the central nervous system. It means these drugs have to cross the blood-brain barrier. It means these drugs have to be, you can say, they can dissolve. They have to have one property, that is called as they can dissolve in the lipid, so that they can cross the blood-brain barrier. If it is not lipid soluble, these drugs are not lipid soluble, they cannot goes to the, you can say, the blood, they cannot cross the blood-brain barrier, and as a result, they will not show the therapeutic effect. Okay, they will not show the therapeutic effect. Got it? No problem. So this is about the psychotropic drug. Once again, psychotropics are those drugs which is primarily used to manage the psychosis. What is psychosis? Psychosis is basically a loss of contact with the reality, and it is commonly seen in the case of schizophrenia. No problem. Now, these drugs are either used to cure the mental illnesses, or these drugs are used for the symptomatological management of mental illness. Got it? So these two uses or indications are there, and these drugs comes under the branch, and that is called as the psychopharmacology. That's called as the psychopharmacology. No problem. Now, these drugs are not present Okay, these are not a OTC drug, over the counter drugs. These drugs are prescription based drugs. These drugs are the prescribed by the, you can say, the physician or psychiatrist. Got it? They are good to manage the psychiatric illness. As I said, they are very good to manage the psychiatric symptoms, but they do so certain, you can say, potent side effects, okay, and which you cannot encounter. Okay, they need the immediate attention, otherwise they can take away the psychiatric patient's life. No problem. Now the another thing which we discussed is that there is a difference between the psychosis and neurosis. Okay, psychosis is a very severe, you can say, problem. It can be, you know, you heard about the word called as the delusion. There is another word called as hallucination, and there is another word called as illusion. Okay, these symptoms, there is a bizarre delusion, severe thought disturbance. These are the symptoms of the psychosis. Delusion means misperception. Okay, this is a misperception in spite of the contradictory evidences. Means, suppose I am here, okay, and you perceive me as your, you can say, known one, even though if suppose, take an example, you can take the example, you are seeing me, okay, I am here, and I'm of course I'm a human, but you perceive me as I'm another, you can say, animal, I'm another species, okay, even though other person convince you, no, he is a human, but you have the first firm belief which you hold very tightly, This is called as the delusion. Whereas hallucination is a misperception. It is a mistakenly perceived things. Suppose here you see the board, okay, and if the light gone and you see this board as a, you can say, black hole or as a ghost, fine. And after light come, you see immediately, no, this is a board. This condition is called as the hallucination. Got it? Whereas illusion is something which is, two things is like a similar. If suppose this is the two color, okay, these are the two color. If I draw this color on, you can see the different color based pattern, fine, color based pattern, then you perceive it the different color, but although these are the same color. Got it? This is called as the illusion. Another example of illusion is, as I studied from one, you can say, the professor, and that is, see, this is the one line, okay, and this is another line. Now both the line are similar, but you perceive this line is a bigger and this is a shorter one, but both the line is a similar line. This kind of confusion is called as it is called as the illusion. So whereas delusion is false firm belief, which is, you can say, tightly held by a patient in spite of contradictory evidences. No problem. Now hallucination is the, you can say, misperception. It is a misperception, and illusion is a, here, okay, illusion is a, you can say, the milder form of hallucination. Fine. These symptoms, along with the severe thought disturbance, okay, severe thought disturbance, got it, also called as a mental cloudness, these symptoms comes under the psychosis. These symptoms are come under the psychosis, and these symptoms is basically a kind of, you can say, lose the apart from these symptoms, patient will show, you can say, the social isolation or social withdrawal, okay, lack of motivation, okay, they you can say give up all their, you can say, goals. They give up, they are not giving, you can say, any effort in anything, okay. So loss of motivation, there is a social withdrawal. Apart from this, there is a flattening of emotion. Means, if you take the example, if you found any psychiatric patient which have the very, you can say, severe this condition, psychosis, and if you tell them you won 1 crore rupees, okay, in a lottery, they will not show you any, you can say, expression. There's a flattening of emotion, and medically it is called as the adonias. This is called as the adonias. Okay, flatness of the emotion. Fine. So these are called as the psychosis, and classically it is seen in the schizophrenia. So these symptoms management is done through the use of psychotropic drugs. This is the one indication I said. Now let's move ahead and discuss about the different indication. This is the one indication called as the psychosis, but there are others which we will see now. Fine. Here till now, you have any problem? No? Now let's move ahead and let's discuss that where we are using these, and you can say psychotropic drugs.